Hi guys. Good evening, one and all. Are you able to see the screen? I just need your response on the chat box. Are you able to see the question paper?
Double 54745.
Okay, hope everyone is ready. So we are going to start the session. So I hope like most of you know that today's session is analysis of GT3, right? You're clear, right, about that? So this is basically the analysis of GT3, how you need to analyze the question paper and how you need to Hi. Hope my screen is visible to you. I hope you can see my first question. Okay, fine. So, so the session is basically analysis of your grant test 3. And I hope most of you, okay, whoever are attending this particular session, so are done with grant test 3. So then only it will be more effective. So I'll try to write few things and followed by this is how I analyze, because analysis of paper or a question paper after giving exam will be different by different students and different by different mentors. Okay, so now this is how I analyze the question paper. So I'm talking about GT3. This exam was done on the following subjects, that is dental anatomy, dental histology, prostho, endo, DM, and a few areas of, for example, antibiotics and GIT system. Right, so these are the subjects which are included. And guys, I just want a quick response from you. Okay, so among these subjects, which is the weakest subject for you? What do you feel like? There were like 200 plus students in the live. What is the weakest for you? So you have prostho pharmacology, post. Okay, so I can see most of you answering it as prostho. Okay, so in common, okay, the first analysis what you can take is the toughest subject in the list is prostho. Second one is, okay, a betterly memory based subject is going to be pharmacology. That too only antibiotics are there. Okay, so these are the two things that most of the students are feeling the feeling bad or feeling like they need to revise or something. So now I'm going to tell you the minimal score in this particular question paper by analyzing the entire question paper. So we'll check all 240 questions. This is not doubt session. So I'll tell you what to be focused on, what to be, what you need to gain from the question paper, keeping in mind few basic things. What are the basic things? Checklists. I have given you a checklist for every subject. Okay, every subject. Pro live class, pro live students, you have a different checklist. Okay, regular offline students, you have a different checklist. Normal plan year students will have a different checklist. So I have given you checklist. Okay, keeping in mind about the checklist. So I'll tell whether the question is within our zone or not. Okay, so I want to segregate the columns in a simple way. Okay, one is known question, known and easy, very easy. Known and easy in the sense, okay, you know the concept, and answering this particular question is very easy. Why it is easy? It may be discussed on the WhatsApp, or maybe discussed in the pro live class, or maybe discussed somewhere, or maybe you are very familiar with the question. It's a very easy question, or it may be a repeats question. It may be from Dental Pulse. So these are called as known easy questions. So I'll call it as known, known easy questions, first column. Second column, known difficult questions. Means you know the concept, but you don't know the particular line where the question is being prepared. You know the concept, but you feel difficult. You don't know. You know the concept. For example, the first question is on bleaching. Bleaching, we know about bleaching, but you may feel difficulty after checking this question or after answering this question. So this can be considered as known difficult question. Third one is unknown question. Unknown, but it can be easy question. So you can call it as unknown easy question. And fourth one is unknown difficult question. So these are the 4 columns you should have, okay, in your mind while you are attempting the exam, and you should never give a try to attempt unknown difficult questions. That is the 4th column. Is it clear? Known easy, known difficult, unknown easy, unknown difficult. Is it clear with the 4 columns? Right? Okay. So never ever try a question which is unknown and which is difficult. Okay, those are the questions which you have to leave in the examination hall. Okay, of course, NEET is telling that try to attempt as many questions as possible. That's a logic, or that is a principle that I always force my students to do. But there is something that you should not touch. That is called as unknown. The concept is completely unknown, and even unknown also, the concept sounds to be so difficult. For example, most of you, we are not done with biochemistry. Like, for example, revision, or few of you are not done with biochemistry. For example, a biochemistry question is coming in GT3. Biochemistry, as you have not touched, that is called as unknown. But the question sounds very familiar. You have done 2 months or 1.5 months back. You sounds okay. I have done it, but I'm not very sure. So this is an unknown concept which you have done long back, no proper revision, but the question sounds to be easy and familiar. So you can consider this as unknown easy question, and you can attempt such questions also. Okay, so but in this GT3, I am going to include only known easy questions only. I'll tell you how many known easy questions are there. So by knowing how many known easy questions, you can analyze yourself that how far you are from the preparation. How far you are from the preparation, how bad you are from the preparation. Maybe the reasons may be different. Maybe you may be so busy during this particular 14 days. You may have some other personal commitments, like one of your family friend, or one of your close relative is getting married, or you're not feeling well, or there are many XYZ stuff. Like you may be a mother, you may not have a vigorous preparation time, and compared to many other students who are doing 14 hours or 13 hours. Okay, so can I know one question? How many of you are doing more than 10 hours per day preparation? Minimum 10 hours, more than 10 hours. It's mandatory, guys. It's mandatory. Okay, if you are targeting to be in the 3-digit rank, 3-digit means 1000 below rank. Okay. Or if you're targeting below that, make sure your minimum working hours should be more than 10. It can be extended up to any number, but minimum 10 hours should be there so that you can fetch something better. So straight away, without wasting any time, I'll be jumping into the analysis of the paper. I myself will be writing, okay, writing. You can similarly split them into 4 columns. That is known easy, known difficult, unknown easy, and unknown difficult. So all your stuff which comes in the checklist and they're very easy will be coming under first column. And I'm going to calculate only the first column questions from this particular GT. Okay. And I hope most of you has given GT1 and GT2, then they have started GT3. Okay. If you are not in the list, for example, sir, I have given directly GT3, not GT1 and GT2 because my time limitations were not possible. Make sure before you give next grand exam, for example, GT4 is the next exam. So before you give GT4, make sure try to finish at least GT1. Before give GT5, make sure at least try to finish GT2. So at least by the time you give GT5, make sure 1, 2, 3, 4 are done. Clear? This is, sir, I was talking to a few of you. Sir, I have some other commitments or other things in my mind that I'll finish this and I'll give that. No, that is not going to be possible. You'll have totally more than 25 GT exams. So that is how I am planning for you. Okay. So 25 GT exams is going to turn somewhere around 25 into 240. You just calculate the number. The number is going to hit somewhere around 5,000 to 6,000 concepts or MCQs. This is what my analysis, my plan for you guys. Okay. So if you postpone now, it's going to be so difficult to give a grand exam because giving 240 questions, analyzing them properly, learning the mistakes, it's going to take time. It's going to take minimum half a day to 1 day time. Means one grand exam is going to eat your one valuable day if you're not properly prepared to it. So 25 exams will take 25 days. So you have 85 and they are going to take 25, means you're left with only 60 days. So that is the reason why please try to finish exams on time. This is very important. Okay, right? Is it clear? Before at least, sir, I'm not done with 1, 2, 3. What to be done? At least by the time you give 5, make sure 1, 2, 3, 4 are done. Sir, I'm done with only 3. At least by the time you give 5, try to finish 1, 2, 3, 4. Please, this is very important. This is utmost important. Okay. So regularly we go for a buffet, right? We'll go for a buffet or we are going for a wedding. So in wedding, what we have something called as starters. We have something called as main course and we have something called as an end course that is called as desserts. Which is more important? Which is more important? Main course or desserts or starters? Which is more important? What do you say? Which is more important? Yes, main course is the most important thing in the, so your grand exams and analysis of grand exam is something like a main course. I know that you have fantasy towards starters or you have fantasy towards the desserts and everything. I know that, but if you do that, it is not going to make preparation full or your stomach full. So main course is the most important aspect. Main course is your mock exams and analysis of mock exams. These 5,000, 6,000 MCQs plus last 10 years question papers. So this is going to form the main course. Means you cannot go to the examination hall without preparing these particular 7,000 to 8,000 MCQs. That is your 20-25 grand exams plus last 10 years question papers. Is it clear? This is the most important thing. So I got somewhere around 10 to 15 calls today. Okay, from my old students or their parents. Many of them are calling. Few professors, principals of colleges are calling me. Okay, only thing is I want my daughter or I want my relative's daughter to qualify the exam. They want to qualify the exam. So all the people who are focusing to qualify the exam, all the people who want to stand 1,000 below, first mandatory main course is mock exams plus proper analysis plus the last 10 years question papers, RQs. Is it clear? Is it clear? So these are the pre-requirements of today's session. Okay, right. So now I'll be jumping into the question paper. Okay, question number 1, resorption after bleaching treatment is mainly due to which of the following? Is mainly due to which of the following? Yes, of course, few people may be confused with option B and option D. Option A cannot be answered. Okay, so I'll consider this as known question, but a bit difficult. So I'll be keeping this question in the column 2. So I'll be posting this. This is what this is what I'm writing. I'll be posting this on the group. Okay. Okay. You yourself want to prepare, you can prepare just for your analysis. I'll be posting. So, and secondly, what I'm going to do is I'm going to keep a separate exclusive book for these grand exams. Now I'll be jumping into GT3. So I'll be writing first question. So first question, I don't know. It's a difficult question, known concept. It's about bleaching. I know the concept of bleaching, but this is something new, which I find. I don't know how many of you feel this is a new question for you. So I'm going to write one sentence, or I'm going to write myself. I'm going to revise this question too. So here you can see, you have something called as bookmark option. You can see a bookmark option is there. So what I'm going to do, I'm going to bookmark it. If you want to add any particular notes to this, for example, you want to add something related to the bleaching for your satisfaction. For example, I'm adding some notes. What I'm adding, H2O. Okay, what is superoxide? H2O, 30 to 35% or 100% by volume. By volume is superoxide. Okay. So I'm going to add this and I'm going to keep save. So now this is added to your notes. You can see you can add your notes also for a particular question which you are weak at. And now in this drop box, it is clearly showing that you have marked 17th, you have marked first question under bookmark. So now when you're revising, you can just revise the questions which are bookmarked. Directly you can jump. For example, I'm jumping to 34th question. So 34th question I felt difficult. So I'm bookmarking it. So now 34th question is bookmarked. So I'm going to check only the bookmarked questions. This is how you need to use the website, about the bookmarking or about adding a notes and everything. Like if you feel like a new point should be added, you can add it. You have an option here, bookmark or add notes. So first question, I'm not going to add it in the easy part. Okay, I'm jumping into the second question. Second question, a junior resident. Okay, this is already discussed on your WhatsApp 2 days before exam. Okay, this is a very easy question. So I'm going to add this in the first column. You should not go wrong in such questions. Okay, the next is EDTA, percentage of EDTA, pH of EDTA, hydrogen peroxide and everything 2 days before the exam. It was discussed, very commonly, familiarly asked question. So I'm going to add one more score. KIMS class 3. Okay, I told you, right? I have given a checklist of classifications to be done. In that, KIMS is included, of course. I'm going to add, this is an easy question. You should not go wrong. So this is something like, you can consider it as in third column or fourth column. Like, I don't know how many of you are very familiar with general anatomy, or you're familiar with pedo, because this is a combination of pedo plus general anatomy question. So I'm not going to include this question. So you have to learn, like, for example, you don't know this, you have synopsis, please try to learn and move on. This is a difficult question. Next, greater adhesion is associated with, we have learned this concept. Okay, so I am going to add this as an easy question. Of course, we have discussed about this. Okay, gold 750 fineness. Okay, I'm going to add this an easy question. A big case-based description part is there, and the question is very simple. Avulsion, what is the time period they have asked? We have learned this, that is 7 to 10 days. So I'm going to add it in the easy part. Then comes enamel infractions. These are minute cracks, which we know it's an easy question. And of course, this is again a pedo question, which is definitely, I'll be categorized either into difficult unknown or difficult easy. Okay, so this is a very familiar classification. I mean, this is a very familiar thing when you're talking about the behavior management and your child psychology, but I don't know like how many of you are really done with this. So proper revision is required for this question. So I'll be not considering this question. So we are done with 10 questions. So out of 10, 7 are in our zone. You should go 7 plus right answers till this point. If not, then you're going wrong, because most of the 7 questions were already discussed on the WhatsApp, already discussed in different modes, in different patterns. So you should never go wrong. Okay, so again, alginate agar classification. Before 2 days before exam, I have discussed alginate classification. The same question was given. So I'm adding one. Actinomycosis is something very, very familiar. Okay, even if you don't know now, okay, So you have to learn actinomycosis, which is very, very common. And they're very simple question. Multiple sinus openings, yellow color granules. That's the simple keyword where you can go for it as actinomycosis. This is a very easy question. Preferable route of behavior management. Anywhere, child most preferable route is oral route. Easy question. This is ortho. I don't know how many of you are perfect, but as it is an ortho question, I'm not considering it as easy because I am very, very liberal in counting the minimum number of right answers you should get. So this is also a very easy question if you're done with ortho. If you're not done with ortho, then it's going to come in either column 3 or column 4. Danger zone, easy. MTA composition, easy. Sibbert's classification, easy. Pharmacosol pulpotomy, easy. I don't know how many of you are familiar with polishing, so I'll consider this as known difficult or unknown easy. Okay, so I'm not going to consider this. I mean, it's an easy thing. Like if you're in preparation, unless you're not exposed to this, that sounds odd, but it's a very, very easy diagram based question. So in the first 20, you should make 15 plus right answers. You should make 15 plus. They are within your zone. Most of the questions are within your zone. Primate spaces within your zone. Catgut, already discussed so many times, within the zone. Oh, this is discussed 3 days back before the... Is it discussed, guys? Have you checked it on the Telegram group? Is it discussed? Peripheral nerve system develops primarily from... Yes, it is discussed. It is discussed on your WhatsApp activity. If you are going wrong, sir, this is embryology, I have not read. If you are going wrong, then you should question yourself because this question as a single liner was discussed on your WhatsApp. So then you should think that, okay, I'm not checking out the Telegram questions. I'm ignoring the Telegram question. This may not be in the syllabus, but this is discussed. This is discussed. Okay. So if you're going wrong this question, you're not perfect with Telegram content. This I'm not going to include. This is a very simple common sense question. How many of you made it right? Right. I have not discussed this question directly, but 2 days before exam, I told you what is a unit of blood called as, what is a fist of blood called as, what is big mop of blood, how much it is. It is very simple calculation. Rest is everything common sense. He's telling that he has collected something, he has used some irrigation, he has removed something from the section. It is very easy. Okay. I don't know how many are feeling it is difficult question, but all the things were indirectly discussed on the group. So I am going to add this also to the question. Okay, pathology question. So I am not including this question in the list. IQ, if you're already done with pedo, this is easy question. You will not forget. If not, it's going to be difficult. I'm not including this also. I'm very genuine. I'm not including this. Assuming that you have not started your preparation. This can be either hematoma or cyst, but preferable option is cyst. Okay, both A and B are right, but preferable option hematoma is nothing but called as cyst. Okay, so both A and B are right, but you cannot go for all the above. So option C is eliminated. So better option is cyst rather than going for hematoma, basing upon the findings of the clinical descriptive part. So I'm not including this also, as few of you may think of it as a controversy. This is discussed on your WhatsApp 2 days before the exam, so I'm including it, and so many times given in the dental pulse also. This is something new. This is something new. Okay. This is directly from your dental pulse, so I'm including. Faces, I told you to check, included. This I'm ignoring. I'm not including. This is direct question. Water trees we have discussed 2 days before exam. I asked you to check casting defects. I think this question was discussed in the offline and pro live. I don't know about the rest. Okay, this was discussed in offline and pro live. I'm including this. This is direct dental pulse question. This is within our zones. I told you to check out the faces and everything. this was so many times repeated, and logically also you can think of, you have so many times seen amalgam and most of these restorations on radiographs, but I'm going to include it as unknown easy question. With elimination, you can attempt this question. This is direct dental pulse question. This is direct dental pulse question. This sounds too lengthy, but very simple question, 44. This is direct dental pulse question. And one more important thing, for example, I hope like you know the answer for these questions, but whenever you don't know answer and whenever you want to attempt, go for both, all of the above, such options you can, or else you can pick option which is largest among the list. What is the largest option? You can go, like you're in a situation where you need to attempt the questions. So in such conditions, it is safe to go for these answers because there are high chances that in more than 60% of the cases, these answers are going to be right. Nikhil, easy question. Easy question. I told you to read this. I posted the table also. Easy question. Easy question. So we are done with 50. So out of 50, how many are within the column? One is 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38. So out of 50, 38 questions are within our zone. Easy questions. Easy questions. They're within the syllabus also. Next, easy common sense question. If you don't know, you can consider it as known but difficult. I'm considering this. I don't know how many of you know this. I don't know basically. So that is the reason why. This is easy question. This is easy question. Easy question. Easy question. I'm not considering this. Not considering this. Not considering this. Not considering this. Just it is not out of syllabus. This is already discussed on the WhatsApp. I mean on the Telegram. This is already discussed on the Telegram. Okay, I'm not considering this also. This is discussed. Common sense, easy question. Common sense, easy question. Collagen types, easy question. Number of roots, easy question. Sequence of eruption, easy question. Oh, veins and vertices, easy question. Oh, mandibular second premolar occlusal patterns, easy question. How many of you went wrong in this question? How many of you made wrong? None of you? So if you are wrong in this question, okay, so I want you to consider this as known difficult question. You know the form C factor, everyone in the world knows C factor, but you are going wrong means you don't know how to calculate the C factor for M-body. Okay, right? M-body C factor, like you have to calculate it as like the unbonded is, the mesial side is unbonded, distal side is unbonded, and occlusal surface is unbonded. And bonded is you have to consider the entire buccal area as one bonded surface, entire pulpal area as one bonded surface, entire lingual area as one bonded surface. So it is going to be 3 by 3. It is 1. Okay, so that is how it is calculated in one of the standard book. Okay, so okay, of course you can calculate it as individually also, but this is how they have calculated and they have closed it. But you check out the option, basing upon that you consider all the bonded surfaces and try to, you don't have such option. Now you can consider it as 3 by 3. Okay, so this is difficult, known but difficult question. Largest diameter discussed on the group. This is not discussed recently, but probably I think this is discussed on your Telegram. You can you have in Telegram also you have one option. Search button will be there. You know that, guys? Telegram, you have search button. Like for example, okay, SAR somewhere has discussed this particular syndrome HGPRT. If you type and search, when it was discussed, it will be scrolling up. Okay, check it out. This is discussed probably 15 days back. Easy question. This is also discussed, not immediately. Easy question. Mesobuccal root, easy question. First generation cephalosporins, easy question. I told you to check out cephalosporins classification. This I'm considering it as difficult. Is it easy? You want me to drop this question in easy? Because I told you, right, to check micro hardness, macro hardness. So micro hardness is something like which is below 9.8 newtons or which is below 19 mu mm. Okay, so this is micro hardness. Above that is macro hardness. I told you to check out the tool diagrams. I told you to check out this particular diagram. At least now, if you are not, if you went wrong, please try to check it. This is easy question. This is going to be easy. I hope you know this very simple raw basics of antibiotics. Maybe known difficult. I'm dropping this as known difficult. This is easy question discussed on the group. Maybe this a bit difficult, so I'm not calculating this. I told you to check out anti-tubercular drugs. Chronic hyperplastic pulpitis, easy question. MTA disadvantages, long setting time, handling properties, easy question. This is biochemistry. So I'm not counting this. This is basically easy question in biochemistry, but I'm not calculating it as an easy question. I'm not calculating this also. I'm not calculating this also. I'm not calculating this also. I'm genuine. I'm not calculating. I told you to medical termination of pregnancy. The same question was posted on the group. Easy. I told you to check out all the common points, adverse effects of anti-tubercular drugs. So you have to do this question at any cost. This question was posted on the group. Okay, this is very simple. I hope you can handle it. This is simple. Butt joint is simple. This is discussed on the group. Macro hardness. Indications of pit and fissure cilius, easy question. This is also easy question. So we are done with 100 and I'm just calculating it. First 50, we need to score 38. The second 50 is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37. So 37 in the next 50. So totally now it is hitting 75 out of 100. First 100, you have to get 75 plus score. And this proper analysis, I am only the perfect because I take your, I'm the one who has taken the last 15 days Telegram activity. So I know what I have discussed. I know what I told you to study. I know what I have discussed in the quick revision. So I know what are the given in the exam. So you should get minimum 75. Very genuine is 75 plus in first 100 MCQs. Is easy or difficult? Very easy question. Rubber dam given by. Easy question. Single doses, easy question. Day before exam, it was discussed on the group. Day before exam, it is discussed on the group. Very common question, mode of action of each particular antibiotic, where it is added, cell wall, easy question. Vancomycin, again, same question repeated. This is also discussed 2 days before exam on the group. Rifampicin, I told you to check out anti-tubercular drugs. Vancomycin, so many times it is given, right? If you know proper meaning of this colitis, there were 4 or 5 questions straight away on this, very important topic. Thickness of rubber dam, I told you to check. This table is already there in your PP books also. McCain's solution already there in PP books, very important. String out test was discussed on your WhatsApp activity in the last 15 days. Chrome hue, everything were discussed on your WhatsApp activity. I told you to check out the eruption sequence, top to bottom, you should be perfect, right? Same question was given. The same question, sex dimorphism, same question was repeated twice. Okay, and this is also discussed in the COVID-19 classes. Tooth slot, very easy question. This is very easy question. I'm not including this. I'm not including this. I'm not including this. This is easy question. 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 It was discussed, right? What are the instruments which are having a 4-digit formula? I have discussed. Easy question. I told you to check lasers. Again, lasers question. I told you to check the fillers classification question. I'm not considering this. I'm not including this. I'm not including this also. This is direct dental pulse question. I'm not including this. This is very simple common sense question. This is simple question. I told you check out this classification. Oh, immunoglobulin saliva, very common question. You have to check about saliva. This is easy question. Ducts. I told you to check enamel, lamella, easy question. I have discussed this also. Glands is easy question. This is also discussed on the WhatsApp. This is also there in your PP books. This you can consider it as difficult. It's there in dental pulse, but I'm not calculating this. Post length, easy question. It's there in the post class. This is types of occlusion. You have one smart video on types of occlusal types in your dental anatomy. So straight away, the question is from that area. Fifth cusp is an easy question. I'm not calculating this polishing of amalgam. This is easy. Easy. Easy, very easy. Very, very easy. Very easy. Very, very easy. Discussed on the group and that very easy question. Discussed on the group and easy question. This is a bit difficult. You should have a proper, you should know the exact locations of this to answer this question. Easy, 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 easy. I told you, right? This is also discussed. You can check it in the Telegram search. So I told you silicates. What is the ppm? How much ppm? Highest is silicates. How much ppm? GAC is in and around 5 ppm. Easy, common sense it is. Irritates, silicates, easy. I told you check the number of lobes. Okay. Easy. T contact, easy. Layers is easy, but I'm not calculating this. Grossman's vitality test is heat test, easy. Vitality is easy. Formalin should not be used, easy. Halo effect, vertical root fracture, easy. Extraarticulation, avulsion, easy. Least indicated because of the presence of mental foramen. Easy. Largest organ, liver, easy. I discussed this when I'm taking enamel dental histology discussions. I told you to remember the stages and the landmarks. Dead tracts is easy. I told you to check all the occlusal patterns and all the diagrams directly from Whalers, easy. This is also direct from dental pulse, easy. I'm not including this. I told you to check the tooth number classifications, easy. Prior abutment, easy. I'm not including this. This is easy. I'm not including this. This is easy. This is there in your PP books. I'm not including this. I told you to check the major connectors, diagrams, indications, and everything. Line angles, point angles is very easy. That is a first year question. I'm not including this. This is easy. How many of you know this? You know endo block? Okay. If you know, it's an easy question. If you don't know, now you have to learn it. Okay. Right. So I'm not calculating that. This is an easy question. This is a dental pulse repeat, but I don't know how many of you are, you know about this. Is an ortho. Okay. So I'm not calculating that. I'm not calculating this. Ligaments of temporomandibular joint, easy. This is a general question. This is a general fundamental question. They call it as fundamental questions. Means you should know the basics of life. Some questions may come on basics of life. Okay. So I'm not calculating this also. Occlude caries, so many times repeated, easy. Osteoporosis, easy. Oh, this flap is easy. I'm not calculating this. Masseter, easy. Replaces, easy. Classification, easy. Sounds, I told you to check, easy. I'm not calculating this. I'm not calculating this. This is easy. Cast restoration, primary indication is used in elliptical and flared up canals, easy. Ideal seal is easy. Socket preservation, easy. This is easy. I'm not including this, but this is more of a common sense. How many of you made right? This is a very a common sense question. Means basing upon the options, you can go with the right answer. Gloves, you use glasses, you use shield mask, you use, but laboratory coats are not required for the universal precautions. Okay, they are used in laboratory. I'm not including this, but I'm including this very easy oblique reach. This is easy. Not including this. Easy. Easy. I told you to remember cementum dimensions, very commonly asked question. I'm not including this. I'm not including this also. This is easy. This is easy, but I don't know how many of you are perfect with vitamins. This is also easy. I'm not including this. Oh, smile design, very commonly asked question. Even last year, 2022 NEET, this question was given. Value, easy. This is easy, prosto question. Finish line, easy. This is easy. Reverse 3/4 crown, where it is used, easy. Asthma patients, if you don't know, learn it, because morning allergy chances will be there. So you have to go for late morning appointments. I'm not including this. This is easy. I'm not including this also, but this is easy. I'm not including this. This is easy. PKT numbers are easy. The space between hygienic and rich, this is easy. If you don't know, learn it. I'm not including this. And this is easy. Okay, so first 100 questions, 75. So next 140 questions, I'll tell you. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60. So I'm getting 183 out of 240. So I'm making it as 180. Okay. In that, you have 10% extra discount. Okay. So I'm removing 18 questions. So 162 means 160 plus with all the liberty. Anything above 160 is okay for this question paper. If you are not able to reach that 160 by following the Telegram group, for example, I mean, let's talk. There's nothing bad here. How many of you have ignored Telegram activity? You have given exam, but you have ignored the Telegram discussions. How many of you? Is there anyone who has ignored Telegram discussions? 180 plus students are there. How many of you have ignored Telegram discussions? Anyone has ignored? It is very important. Even your final questions are going to come from the Telegram discussions. It's mandatory that you have to check the Telegram discussions. Okay. They're very, very important. Okay. They're very, very important because they are going to give you scores. They're going to tell you where you're weak at. I'm going to tell you, okay, you'll be weak at this. Kim's classification, you'll be weak at. Vertices, you'll be confused. Known, easy, you should never go wrong. That's what I'm telling. My analysis of the question paper is I'm telling which questions are known and easy for most of the students. You may tell, okay, Kim's, I never heard Kim's, sir. You have to, because it is known easy. This question is falling known easy for more than 90% of the students who are in the competition zone. You should never go wrong in such question. You may be least aware. Sir, I have started my preparation 2 days back. Even if you start preparation today, you should know Kim's classification, because for the competitors who are in the competition zone for you, 90% is the Kim's classification is known easy question for them. So always a question should be decided basing upon the competition zone. So known difficult, you should fetch it. Unknown easy, you should fetch it. Unknown difficult, you should not feel bad for unknown difficult question. Right. So I hope like most of you got some basic knowledge how to analyze a question paper. Is it right? I have taken such sessions in offline long back. but not in the online. So this is the first time I'm taking an online session, like how to analyze. This is how you have to analyze. 90% of the people, like even if you don't start the preparation, even if you're about to start the preparation, this is how, okay, this question paper requires minimum 160 plus to be in the 500 list. If you want to be in the 500, this question paper require 160 plus, because questions are within our zones. It is very easy. Screwed eye shape, maxillary central incisors. You should not go wrong in this question, because everyone knows that it's a congenital syphilis. That's an easy question. Sir, I don't know. Learn it now. Now you learn it. Read it. Read all the things which are given in the congenital syphilis, all these notes. But make sure once the same concept or congenital syphilis based question or a syphilis based question is coming in the next examinations or next GTs, make sure you should go for a right answer. This is how you have to analyze. Wherever you're going wrong, please do mark it. For example, question number 4, sir, Kim's classification. Very tough. Write a sheet, write a GT3, question number 3, Kim's classification, I have to revise. So before going to GT4, make sure you open these notes, or very simple way, you can open the website. I'm going to mark it. Bookmark it. Okay. I'm going to save it, and I'm going to check all these questions, and I'm going to check the underlining concepts. I'm going to directly, because 240 questions you cannot check. It is very difficult. So what I'm going to do, I'm going to jump to the question number 1. Okay. Question number 1 I'll check. Question number 34 I'll check. Question number 111 I'll check. Okay. This is very important. I'll be confused. Okay. So what I'm doing, I'm going to keep it in the bookmark, and I'm going to revise the 20 or 30 mark questions before I go for the next GT. So once you're going for GT4, so GT1, GT2, GT3 has to be, for example, there are 25 difficult questions in GT1, 25 in GT2, 25 in GT3. So I'm going to revise all these 75 questions, and then I'll be going to the GT4. My assumption is whether question is going to come within the zone or not. I'm least bothered. Sir, will the questions come from GT3, which will be there in GT4? I don't know, but I want to make myself strong in the weak areas where I'm previously at. So if you keep on revising this, okay, thick, medium, heavy, extra heavy, super heavy, for 4 or 5 GTs, then it will be recorded in your permanent memory. So you have to convert things from short-term memory to the long-term memory. How you can convert a short-term memory to long-term memory is revising them more than 5 or 6 times. So this table has to be revised. So I'm going to bookmark it. Similarly, for example, any other one which I feel like, okay, I need to revise, so I'm going to check it. I'm going to keep a bookmark. Okay, so vitamin K factors 2, 7, 9, 10 SC. Okay, I'm going to keep a bookmark it. I'm going to revise this. Okay, so on which you have to decide, okay, I want to learn about this particular syndrome. Okay, so I want to bookmark it. So this is how you have to identify the areas where you are weak at. And for example, okay, I want to check out this different types of agents which are used for pulpotomy. So I'm going to bookmark it. So you have to make yourself the zone where you need to revise. Some people, like, they may know everything. Okay, they may know this. So they will not revise it. It's unnecessary to revise things which already you know it. Okay, right? So right, is it clear? So this is how you need to approach, and make sure you have to revise. Okay, for example, this week you have done 2019, 2018 question paper. That has to be revised before you go to exam. Not all the questions which requires your attention, questions which requires revision. For example, a classification is there and numbers are there. You have to revise, mark it, go back, bookmark it, go back, try to revise only that area. Guys, is it clear? So if it is clear, I'll go to the next part of today's session. I need your response on the box. Don't feel bad even if you are getting 300, 350, 400, because we have 80 plus days. Okay, even if you improve one right answer for every 2 days, means 80 by 2, you have 40 days, 40. So there is scope that you can improve your score by 40 marks. I mean, I'm telling, every 2 days, can't you make one right answer, working so hard, 10 hours, 12 hours per day? Can't you improve one right answer at least per 2 days? No, I'm just asking people who are still at 300s, 350s, don't feel bad. The only thing I'm asking is, you're going to work 12 hours or 13 hours per day. Okay, so 2 days, you're going to work minimum 25 to 26 hours. In 26 hours reading, can't you make at least one extra right answer? Only one extra right answer I'm asking. 25 hours, can't you make one right answer? No, you can make it. Easily you can make it. For example, your scores are 300 now. Least 300. Okay, consider just 300. So for example, you are making 40 right answers by 80 days from now. So 40 into 4 is 160, and your negative marking will be dropped by 40. So it's going to be 200. So 300 plus 200. So your score will be 500. Even a student who is at 300 now feeling bad that you are not going to qualify or not going to achieve something, there are high chances your scores can be improved to 500 plus or above that. The only thing is analysis. The only thing is what to be done. The only thing is what to be revised, what to be ignored, what to be stressed. This is important. If you can decide that, if you can judge that, okay, talk with the mentors, come to these live sessions, okay, take some knowledge from the mentors. Subject wise knowledge is there on the website. That's not an issue. Knowledge or a common sense where you need to stress to improve your scores and give a better attempt in the final exam to get a better result. So that comes over a period of experience. One is trusting your mentor. Second one is you give more mock exams. You also will get more experience. Just imagine you have given 15 mock exams and you are planning to give the 16th mock exam. How confident you are, how confident you'll be. You are at just third mock exam now. Just imagine that you have given 15 and you're going for 16. You'll be having more confidence. Just imagine that you're giving 20 mock exams and giving a 21st. You will be more confident. Trust me, this is with experience. As you give more exams, you will be more confident, and this is going to happen. Okay, right? So I'm done with that. Okay, so if you have any questions to be asked personally, or you can drop it on the message box. You can, like, if you feel you want to be very personal, you can drop it on to my WhatsApp. Simple, drop it on my WhatsApp. I'm active now on the WhatsApp. I have opened my WhatsApp. So if you have any questions, you don't want to disclose it out, you can directly drop me on the Telegram, sorry, on the WhatsApp on my number. I'll check and I'll answer your questions. We'll not let your name out. Okay, don't worry. Please do message me on the WhatsApp only, because I cannot check your Zoom messages as of now. Try to post any sort of question. Please try to post on the WhatsApp. I'll definitely try to help you out. Yes, I got one question. Okay, meanwhile, you can drop. Okay, so, sir, I have started my preparation like probably a week back, where I was not very clear about your module 1 also. Okay, so people who have started preparation in the last week or last 10 days before the module 1 started, don't break your heads. You try to focus on module 2 only for now. Okay, because module 2 will be going for 14 days. Module 3 will be 14 days and module 4 will be 14 days. Okay. So for example, it's going to be roughly around 44 days. You have 88 days. So you'll be completing the 3 modules by 44. So you'll be having 40 days left over for your revision mocks and everything. And like it's complete mocks and everything. So in that we'll take 10 days for module 1. So you'll keep 30 days for revision. And in that 40 days, you're going to keep 30 days for revision, and you're going to take 10 days for module 1, and you're going to finish module 1. Don't worry. Don't assume that I will not have time for module 1. You will have time, because I have given 40 days there. In that, you are going to take a week or a 10 days, because you will be on fire in the preparation by that time. So you can use that 35 days for revision and use that 7 days or 10 days to finish module 1. Module 1 subjects are comfortable subjects. Endo is comfortable. Most of the subjects in module 1 are so comfortable and easy. So it's going to happen. Don't worry. First, focus on module 2. Get adapted to these GTs. Get adapted to these GTs. Get adapted to giving more grand exams. Okay, and once you start giving more exams, your scores will drastically improve over a period of time. All right. That is one. Where to see bookmark questions? Open your question paper, yeah. Open your question paper. See, this is my question paper. Open your question paper, which is answered. Then whatever bookmark you are going to mark, you can see the bookmark questions. WhatsApp activity has to be attended live or only like when you are taking? Your wish, but make sure it has to be done. It's not mandatory that you have to eat everything when it is immediately prepared, but make sure you eat whenever it is possible, but please do eat it. Don't miss it. Okay. Like good if you attend it live. Even if it is not, it's okay. Whenever you want, you can come, attend, finish the task. Make sure whenever it is possible. Like what I strongly recommend is, okay, it's good if you attend live, but there will be few busy people. Okay. You have some personal works. Okay. Make sure whenever you're traveling, whenever you're on a call, whenever you're on a place where you don't have access to the books, make sure you can finish your Telegram activity. So that's an answer for those questions. So I got 168 right questions, but sir, getting 50, 55 negative marking in every exam, how to deal with it? Improve your right answers. As the number of right answers are going to increase, the number of wrong answers are going to decrease. Even if you take Shweta, who is an All India 8th ranker from MDS CONQUER, she went wrong in 40 odd questions, 40 questions. Now you're in the range of 50 to 55. So try to drop that 50, 55 to 40, 45. You will be, maybe you may be the next single digit ranker. Means All India topper will also have 40 negative marking. 40 negative marking is common. When it is common, when your scorings are more than 160, 170, 40 negative marking is accepted. It is very simple. You try to improve the number of right answers and the negative marking is going to decrease simultaneously. Same answer for the next question. Sir, how to handle negative marking? Keep more right answers. Negative marking will decrease. How should we talk to mentors? No, first thing is purpose of talk to mentors is very important. You cannot simply call and discuss which is not relevant to the preparation. I don't encourage, because I am seeing so many students in this present generation. They call us, they talk something which is not related to the preparation also. Okay, that is also accepted at one level. But the purpose of talk, like now you got answers to so many questions. So now you have a chance that the mentor is sitting in front of you. You have a chance to ask questions personally and he's answering it. Use this. This is how you're talking with mentor. He's going to give you a suggestion. It's not about talking with a mentor. It's about taking suggestions, proper suggestions from the mentor, basing upon your situation. So this is how it is going to turn good for you. Okay. You can call me here. You can call me immediately after the class. We can have a talk. How to plan subjects which we are weak at. You split your day. That's what I'm telling. I'm asking you to go for more than 10 hours. For example, 12 hours. You're going for 12 hours or 13-hour schedule. For example, if you feel like you are weak at a particular subject, you make your daily schedule to 10 hours and give some 1 hour, 2 hours to the subjects which you feel you are weak at. Maybe it may be subjects. Don't consider at this level of preparation. And just a second. Yeah, you are a long back student. So at this level of preparation, as you're done with most of the subjects twice on the schedule. So I strongly recommend, don't consider a subject as difficult. Consider a particular few topics in a subject as difficult. Entire subject cannot be difficult. Entire subject will be difficult. Sir, dental histology is difficult. Entire DH is difficult, or a particular concept may be difficult. Enamel is easier. Dentin is easy. Pulp is very easy. I'm an endodontist. Enamel, dentin, pulp are easy for me. Maybe for me, difficult is development. For example, a periodontist coming, their difficulty is going to be pulp. So you cannot consider entire subject as difficult. Okay, remove that from the brain. Sir, entire subject. No, entire subject cannot be difficult. Easy parts will be there in every subject. So what can be difficult? Some topics in a subject are difficult. So change the wording. That's going to give you more psychological happiness to get more confidence. Most of my wrong answers are simple questions, which I have already solved it. Solve more number of times. You're going wrong in simple questions. You're going wrong in known questions. You are doing big mistake. You're doing big mistake. Okay. For example, you're traveling from your college to your room or your college to your home. Will you go wrong? Sir, instead of taking left, I have taken right, sir. I went to somewhere. You cannot do that. That is biggest mistake. Instead of going to your room, you cannot go to others' room. That's the biggest mistake. So solve this issue. Okay, make sure you need to work more on this. Means the problem here is you are taking it as granted. You're taking it as granted. Sir, easy question. I know this. But exam is going to tell you, you're wrong at this. So you're taking just it as granted. That is the reason why you're going wrong. So don't take anything granted, whether it's an easy question. So rubber dam was given by easy question. I know it should not go wrong. Okay. So we should never take anything granted. Please try to be serious about that. I am doing my preparation from October and studying around 10 hours. How should I improve? Try to improve the time. Life is always like, for example, if I'm earning 1 lakh per month this year, for example, what is this? December 2022, I'm earning 1 lakh per month. Do you want to earn same 1 lakh in December 2023? Anyone? You want to earn more, or you want to earn less, or you want to earn same? No, normal, genuine question I'm asking. December 2022, my earnings are 1 lakh per month. You want to earn more or less? So, right. So this is very simple. Like we always should focus on upgrading ourselves and improving ourselves. We need to improve ourselves. Okay. So exam by exam, we should find to improve. For example, sir, I'm reading 10 hours for now. At least tomorrow, you try to read more than 10 hours, 10 minutes. I'm not asking you to go for 15 or 16. I'm telling very simple, go for more than 10 hours. That can be 10 hours, 10 minutes is also more. So give a try to improve your schedules and improve your times. How to overcome numerical mistakes? Revision. You know you're weak at particular point. You should be careful. For example, traveling on road, again, same question. You know that at a particular junction, there are no lights and the road is completely lots of ditches, everything are there, water is there, flooding there. What we'll do? We'll go slow. We'll be careful. Same numbers, you should be careful. Will GT4 be cumulative or module 1 and module 2? Don't know. Anything can come. No, you are at a preparation phase. There is no boundary for this. Sir, give me only endo, I'll do endo. Give me only main course, I'll eat main course. No. Whatever I keep, whatever is going to come in front of you, you have to solve it. So I'm not going to tell you whether it is on this, basing upon my mood or basing upon the team, whatever we feel which is important, we are going to give. I am giving very less time for preparation because I need to take care of my kids' home. As of now, I am thinking of to focus only on Telegram groups and mocks. What will this be a good result? No, that's what I'm telling you. Preparation has limitations. I have some limitations. Okay, but I cannot expose my limitations to you to make your limitations. Okay, Srikanth sir is not teaching, not talking with. That should not be our limitation. So what we do, I consider my personal life as a personal life and my professional life as a professional life. If I include my personal life, for example, one of my relatives is not feeling good. I cannot simply come and tell my relative is not feeling good. I may not be available for you for the next 10 days. It will not work out because I'm in a responsibility position. Same, right? So also you're also in a responsibility position for handling the preparation. So I'm not telling to sacrifice the health or the well-being of your kid for the preparation, but I'm telling you there are few things that you can sacrifice. Don't sacrifice your kid. Okay, you can sacrifice few other things. You try to focus on sacrificing those things and converting into the preparation. And all the mothers, I don't know how many mothers are there who are going to hear this class live or recorded version. Okay, preparation is also a kid. You have one kid, right? Now preparation is also a kid. So you have to take care of your preparation as kid, how you're going to take care of your kids, daughter, kids and everything. So if you take care of your preparation as also a kid, preparation is going to give you something extraordinary to support you in the next few years of the life. So I want you to consider preparation as also one kid and try to allocate more time. You cannot simply stick on to Telegram and fetch something extraordinary. So if you stick to Telegram and all these things, your GT scores were somewhere around 450, which is very decent. Okay, so there are high chances and scope that you can improve a lot. But sticking on to Telegram, your scores will be in and around 450 to 500 or maximum 550. You cannot go beyond 550. So try to get some more time. If not, it's okay. Whatever you're doing is really good, really extraordinary. Okay, this is maximum anyone can do. You're doing it within your limitations, but you check out the possibilities where you can extract more time and focus on, because preparation is only for this 85 days. After 85th day, after March 2nd, is there anyone want to read Dental Pulse or want to check out the Telegram discussions? If anyone want to check out the Telegram discussions on after March 1st, it sounds very odd. I myself will not take any discussions. The group will be closed. Okay. So point is very clear that try to extract the time, try to respect the preparation. This process, you should respect. How you're taking care of your family, you should take care of this process also. Next, I am from the people who is 100 days plan. It's difficult to complete whole syllabus. I have completed endocons, but in the next step, we are unable to complete 1/4 of the dental material, and next we are unable to complete 1/2 of the prose. So it's very difficult to include 30 minutes accommodation for subjects other than the subjects that has been. No, we have to do it here. So you yourself have decided that I am going to do 100 days preparation and I'm going to get 1,000 below rank or 500 below rank. This is our target, right? This is our target. So if you have such targets, then you need to come out of the box and you have to work for those targets. It's not mandatory. Okay, people who are getting all India single digits or people who are scoring great ranks, or let's take about the topper of this today's examination, even that fellow or a person that particular he or she have not completed the syllabus. It's not, that's what I'm telling. Before we starting the 100 days plan, I told you completing syllabus is not our target. Improving your scores, improving your confidence is the target. No one cannot complete syllabus here. Even I myself teaching from last 9 years. Okay, including okay, if you include my preparation, it goes somewhere around 10+ years. So I myself are not able to complete. I am not satisfactory in teaching 100%. I'm not having 100% of satisfactory. So there are few students who are from last year, before last year batch students. We try to improve every year. But 100% satisfaction, I never get till the date. That is the reason why I'm still in this race. I'm still showing some interest to teach, to learn, because I feel like, okay, I should give more for the next batch. So that goes with the preparation. And that too, this message is dropped by my last year student. She was last year also Conquer, and now it's also Conquer. So remove that. Completing syllabus, no one can do it. But achieving rank, everyone can do it. Everyone will get a rank. So I want you to have a better rank than last year. Better scores than GT2 and GT4, than in GT5 compared to GT4. This is how our target should be. Smart videos, please check out this about the questions were about smart videos. Okay, so please check out my 100 days video, which is there on the YouTube channel. If not, ping me after the class, I'll send you the video. You should check that video. Now, smart videos, you 1300 smart videos are there. You have 80 days. How many videos you have to do every day? You have to do more than 20 videos every day to finish those 1300 videos, which is impossible. How to deal with depression thoughts, focusing on preparation. Life is very simple, yaar. This is very common. Depression, mood swings, out of focus is very common. Why? You are young. You are in a phase where you will face all these things. For example, most of you, me, everyone are there in 11th and 12th standard. We used to be there in Sri Chaitanya, Narayana, preparing for entrance exam. We don't have these depressions at that time. Why? Because our mind is not so mature to have those depressions. Our main goal is eat food on time. Okay, and read and go for outing and spend this. These are the qualities which I don't know about you, but these are the qualities which I have. Eat food on time, gossip with the friends. You'll have good friend circle in Sri Chaitanya, Narayana and all this face. Gossip with the friends. Sunday outing, you go watch a movie, eat biryani, come back and read. These I don't have any depression here during 11th and 12th. Now I have depressions. After joining BDS, first year is fine, second year is fine, third year depression starts. MDS, every time everyone has depression. The only thing is how to come out of this is very simple. You have to love yourself. You have to love the process. Now I'm taking some time talking with you. After the class, I have so many messages to reply. Tomorrow morning, I need to catch something and I have to go my relative's wedding. Going to relatives' wedding is also depression. I have to go. I don't have other option because they're going to kill me. Because they came for my wedding, I have to go for their wedding. This is how the Indian culture is going to work. They came, you come. If you come, then only they will come. Okay. So I have to go, but I have some work to be done. I have to talk with you. So this is also some sort of depression for me. But what I'm going to do is I love the process. Taking time, talking with you, interacting with you. I love this process. So once you love the process, there will be no depression. Sir, I cannot love this process. Start loving it at least now. Because this process is going to give you some extraordinary things in the life, personally and professionally. So once something or someone is going to give extraordinary things, you should respect that and you should love that. So start loving yourself, start loving your work, start loving whatever you do. You will come out of this. It's difficult to manage 10 hours, maximum 800 hours it coming. No problem. Whatever you do with kids, anything is accepted. You are carrying a kid and you are carrying the preparation on the other hand. This is an achievement already. I don't mind whether you get a rank or not. All the women who are preparing with kids, who are preparing with the responsibilities, or men also included in this, don't mind. Okay, you are already an achievers. You have already the victory. Okay, taking a call, having a kids is the greatest thing that you can do. You're doing it extraordinary. Okay, but that's what I'm telling. You should carry one kid which is going to give you a personal happiness, and one kid on the other hand which is going to give you professional happiness. So you decide. Both kids are important. Okay, so you should give that balancing for both the kids. Let it be 2 hours, 3 hours. Try to balance both the kids. One kid, personal happiness. Second kid, professional happiness. How to remember each and every drug and its uses. Revision. Get exposed. Vancomycin, penicillins, tetracyclines. Read 100 times. Read 100 times, 200 times, 300 times. You will remember that. How general medicine people are remembering. Every day we go to general medicine. Okay, we'll tell that, okay, we have this problem. They write a big prescription and they're going to. How they are remembering? Doing it more number of times. Simple. Subjects like pharmacology, how to handle questions. Options are very confusing. Same answer. Pharma is difficult. Same answer. Array, pharma, just antibiotics you have started. Why you are breaking your heads? Only one topic you have done. Out of many systems, pharmacology, we are done with only one topic. One is GIT, second one is antibiotics, and out of the 10 or 15 questions who came for antibiotics, most of the questions I have discussed. Antibiotics are very easy to learn. Don't tell pharmacology that pharmacology is difficult. Don't tell pharmacology that pharmacology is difficult. If you tell pharmacology, the pharmacology is difficult, pharmacology is going to be more difficult. It's going to kill you. So tell pharmacology, even if you're difficult, I'm going to see your end. Then only you can handle those subjects. How to manage previous subjects between main schedule, split and do. 14 hours, you give 3 hours or 4 hours to the previous subjects, 10 hours. Try to work more. Young people, you have to work more. Mothers have responsibilities because they have 2 kids to handle. One is preparation and one is personal kid. Now, interns, you don't have any kids, right? So try to spend more time. Give more quality of time. I started my preparation. I'm trying difficult to complete the daily goals, but I am failing to do because of the college work, quota, some subjects whatever you can do it here. I told you to quit the college, but still you have some commitments with the college. Then you need to compromise in your preparation. One thing you have to give more preference, and second thing will definitely compromise. You have to quit the college. Private college, we can manage if you get a good rank. How can I undergo a few subjects? I did not do ortho. Once the module is coming, first focus on module 2 subject. Don't worry about your ortho. Don't worry about your future subjects or how to handle MDS first year, sir. That is not question now. Now your next focus is module 2 subjects and a great score in a module 2. If you get a great score in module 2, that is going to give you confidence that you can complete entire syllabus and get a good rank. Confidence is important. I can do it. If you're telling, I can do it, that is important. What to be done is not important. No one is going to ask you what to be done. If you can tell yourself that I can do it, in a very harsh way, in a very loud, if you tell yourself that I can do it at any cost, you will do it definitely. No need of any plans or anything. You can do it. I think I'm a slow reader. There is nothing called a slow reader, fast reader. I'm not Usain Bolt. Is there anyone Usain Bolt? Is there on the group? But once a tiger or a lion is coming, I regularly go for these trucks and everything, forest campings and everything. If some animal is coming, then I will run like hell to save my life. So there is no slow runner, fast runner, only Usain Bolt can run. No, everyone can run. But when we are going to run, when the situation demands, we are going to run. Okay, so don't give a tag to you that you are a slow reader. So there is no option in your NEET or any examination. Come out, all slow readers come this side, all fast readers go that side. We don't have anything. So remove that from your mind and start working fast. Everyone before giving their theory exam, one day before giving their theory exam, are excellent hi-fi Rajinikanth robotic readers. Okay, we finish the syllabus fast. We finish every question fast. We go, we crack the exam, we come back. This is what we have done in every exam of all the subjects from first BDS to the final BDS. Just imagine how you used to read, how you used to finish the syllabus. So don't come and tell me a tag, fast reader, slow reader. In last 80 days, all are same readers. Half of the time has been screwed for revising the notes. I can spend only limited time for MCQs. Follow the checklist. Is the checklists are posted for every subject on the group? Guys, are you getting checklists for every subject on the group? Yes, every subject checklist is being posted. So follow the checklist. Checklist is going to give you marks. This whatever 160 plus I told you to get in this particular exam is just a checklist, not doing everything. Try to finish the checklist. But if you have that capability or extraordinary power to do everything, that's your wish. But make sure you should not miss the checklist. How many questions? I have started preparation earlier, but still going wrong with some easy questions. Revision is required. But after the exam, I'm able to answer the same question. That is realization. So please try to include that revision and realization properly. Then you will get that score. How many questions are considered to be skipped? It will be different for different student. If you're already doing good, less number of questions. If you're already doing bad, more number of questions. There, how we are going to decrease the negative marking. So probably by finishing 15 grand GTs, you will get to know how many questions you have to skip. And unable to attempt more questions. How to attempt more questions? No, you have to read, finish the checklists. That's what I told you. I told you 160 questions. You can attempt 162 questions, which is more. According to me, 160 plus is very very good, very decent. But if you're not able to answer 160 questions, the problem is within your preparation. You're not doing the checklists. You're not following the Telegram group. You're not following the mentor suggestions. If you follow mentor suggestions, finish the Telegram group and do the checklist and proper revision, 160, 170 plus in this question paper is very easy. How to plan revision for each module? What should be done first? Synopsis. Hey, you're not following the group. I have given the checklist for every checklists. Number 1, number 2, number 3, number 4, 5, 6, 7. I'm giving. You have to follow the same sequence. Please follow the groups. Started my preparation long back, but when I'm coming to exam, I'm not able to score. My marks are very low. I'm not able to focus how to overcome this. I told you all possibilities, ways how to overcome this. I clearly told you 160, 170 questions are within the zone and everything were discussed on the Telegram. I told you what to be done, what to be revised, and the same questions are coming. This is happening for every exam and this is going to happen for final exam also. You can ask last year students, you can ask your seniors. So please don't go wrong in those areas. According to schedule, some are already done by me. Can I focus on other subjects? Yes, you can. Following mentor suggestions is one, or updating updating or upgrading the mentor suggestions and doing something better is your wish. If you can do it, you can proceed, no issues. How frequent we should revise the topic specific? How frequent we have to revise the topics? Your wish. Your wish. Topic specific exam is not going to take much time. It's going to have hardly 20 to 30 questions, and revision of the difficult questions in that will be less than 5 or 6. So revising 5 or 6 questions is not going to take more than 5 or 6 minutes. So whenever you want, you can revise it. Is it compulsory to finish dental pulse bits? Yes, of course. It's good if you do it. But I'm doing Telegram discussions, smart videos, GTs. I told you, right? Follow the checklist. Please try to follow the checklist. Checklist sequence is important. After checklist, if you're done with checklist, then let me know, sir, I'm done with checklist. I'm perfect with checklist. What to be done next, you can ask me. So then I'll give you the suggestions. During previous OP oral medicine schedule, watching the videos completely. Now, should I directly start doing recent questions, or I should watch the videos? I'm not confident in those concepts. Check the checklist posted on the group in the morning. You'll get the answer. Okay, done. I hope I have cleared all the questions. Right, I have cleared all the questions. Is there anything to be discussed, or shall we close this session? Anything more, you can ping me on the WhatsApp. I'm ready to answer your questions. Checklist. People are missing the checklists. Please follow the checklist. Please follow the Telegram group. Few people are still missing in the Telegram group. Please follow the Telegram group. Please finish the checklist. If you finish the checklist, follow the Telegram group, give mock exams on time, analyze them properly, okay, and spend some quality of time. Very easy to get 500 below rank. Okay, finally, don't think too much. Don't stress yourself. No need to go for depressions, mood offs, mood swings for this. The only thing is trust this process, love this process. If you trust yourself, love this process is going to be beautiful. And second thing, this process, whatever the ups and downs you are going to in this process, will give you more confidence in handling the upcoming stresses in the life. PG is not going to be smooth. Okay, if you're, that is the reason why we always focus to get a government dental college. Why? Just because of stipend. Or maybe the second reason is you will have more OP. Okay, those are the two important reasons. There is nothing hidden or extraordinary reason apart from that. As an Indian psychology, being in India or being in our culture, whenever we see more money, stress will drop down for Indians. More money, less stress for Indians, right? So that is the reason why in PG, if you have a stipend, that is going to make you happy and decrease your stress a bit. But PG is also stressful. Life itself is stressful here. Okay, so there's nothing you can escape from the stress. But what you can do, you can manage the stress. You can manage the stress with stress breakers. You have stress breakers, right, in your prosper. Similarly, life also needs stress breakers. Life also needs stress busters. Okay, and this is how we are going to manage the stress, because stress cannot be removed from the life. Open secret. How it can be removed? Go to Himalayas. Go join in Sadhguru Ashramam. Complete entire life you have to stay in Sadhguru Ashramam or go to Himalayas, then you will have no stress. But stress cannot be eliminated. But how it can be? It can be managed. So this preparation is going to tell you or give you some suggestions that how you can manage the stress. So enjoy the process. Once you start enjoying the process, then there is no stress in it. Okay, so we love to enjoy the enjoyment. So that is the reason why when you're enjoying, there is no stress. So if you love the process, or if you love the reading process, if you love all these things, then there is no stress here. You will enjoy this, you will enjoy the process, then it will be less stress. Okay, right? So just go with your preparation and try to give your best. Okay, so try to follow the voice notes, try to follow the suggestions that are given on the group. People who are following the suggestions, who are sticking to the basics, they're really doing extraordinary in their exams. I'm very, very happy for them. And rest everyone who are in around like 250, 300, 350s, 400s, there is lots of scope, lots of time to improve. The only thing is you should be confident, come ahead, learn everything from your mistakes. If you learn from your mistakes, then only you can achieve this grant. Okay, bye, take care, all the best.